Welcome to The Explainer. Today, we're diving into a topic that is absolutely critical for men's health, especially for anyone who's hit that 50 milestone. We're unpacking the silent reality of prostate cancer, and we're leaning on some incredible insights from a seasoned urologist who has over 2 decades of clinical experience. So this isn't just a bunch of dry medical data, you know? This is really about rethinking how we approach our health, how we protect our quality of life, and quite frankly, how we save lives. Let's get right into it.
Okay, quick question for you. If I asked you right now to name the early warning signs of prostate cancer, what instantly comes to mind? For a lot of guys over 50, they immediately think of those annoying bathroom issues. You know, the ones waking up 3 times in the middle of the night, dealing with a super weak stream, or just that nagging feeling like you can't quite finish. It's totally natural to assume that those are the early red flags of prostate cancer, right?
Well, here is the absolute shocking truth. There are 0 early symptoms of prostate cancer. None. Nada. Completely silent. When prostate cancer first starts developing, it doesn't announce itself. It doesn't give you a subtle little tap on the shoulder. If you're sitting around waiting for a physical sign to tell you it's time to go see the doctor, you are playing a very, very dangerous game with a highly stealthy disease. Now, let's clear up a massive misconception right off the bat. Those frustrating bathroom issues we just talked about, the frequent urination, the weak stream, those are classic textbook signs of benign prostatic hyperplasia, or BPH. That is literally just a benign, non-cancerous enlargement of the prostate. It's super annoying, sure, but it is not cancer. Early prostate cancer is basically a master of disguise. It just slowly, silently expands its territory without a single whisper, completely unnoticed. Okay, let's dive into this because this is where the reality gets really sobering. The source outlines 7 symptoms that are often linked to prostate cancer, but here's the crucial takeaway. If you are actually experiencing these, the cancer is no longer early. It's already advanced or metastasized. We're talking localized physical issues like severe urination problems because a tumor is physically compressing things, blood in the urine, intense bone pain, and new onset erectile dysfunction. And then there's the whole body stuff, like unexplained swelling in just one leg, severe fatigue with weight loss, and anemia. To really drive home just how wildly unexpected this can present, listen to this terrifying anecdote from the source. There was this patient dealing with a stubborn ache in his back. He just figured, hey, I'm getting older, I'm out of shape, I need to exercise more. So he goes out to the golf course. He swings his club and literally fractures a bone mid-swing. No way, right? Well, when doctors investigated, they realized it wasn't a sports injury at all. It was advanced prostate cancer that had secretly spread to his bones, weakening them so much that they literally broke under normal strain. Let's look a bit closer at the physical toll of these later stages. Like, why do we see symptoms like unilateral leg swelling or extreme exhaustion? Well, when the cancer breaks out of the prostate, it often goes straight for the lymph nodes. If it blocks a lymph node on your right side, only your right leg is going to swell up like a balloon because the fluid is trapped. It doesn't happen on both sides. Plus, prostate cancer absolutely loves to spread to the bones. When it invades the bone marrow, which is literally the factory for your blood cells, it shuts down red blood cell production. That leads to severe anemia, dramatic weight loss, and just total crushing exhaustion. Okay, take a deep breath, because here is the genuinely fantastic news. You do not have to wait for any of that nightmare scenario to happen. We actually have an incredibly powerful cheat code to outsmart this sneaky disease. It's called the PSA test. PSA stands for prostate-specific antigen. It's just a simple, cheap, everyday blood test. It measures a very specific protein in your blood, and it can flag the probability of prostate cancer years before you ever feel a single symptom. And this brilliantly illustrates the sheer power of this test. Just look at the United States. Back before 1990, before the PSA test was really a thing, over 50% of guys diagnosed with prostate cancer already had advanced metastatic disease. Half of them. Fast forward to after the PSA test became a routine screening tool, that number of advanced cases at diagnoses just plummeted to 11%. That is a staggering, life-saving drop, and it's all thanks to a quick little blood draw. But, you know, the story kind of flips when we look at this globally. In the US, public awareness campaigns knocked it out of the park, getting screening rates up to around 75%. That's 3 out of every 4 men getting checked. But in Japan, the screening rate is only about 20%. Because so few men are proactively getting tested without having symptoms, Japan is actually falling behind the US in catching the disease early. And that sadly means more men are finding out about their cancer way too late. So who really needs to have this on their radar? Honestly, every guy over 50. But, and this is absolutely crucial,
If you have a family history, meaning your dad or your grandpa had prostate cancer, your risk doesn't just bump up a tiny bit, it doubles or even triples. If this disease is in your bloodline, you absolutely cannot afford to just brush it off. You've got to be extra vigilant and talk to your doctor about getting those PSA levels checked even before you hit 50.
And just to show you that this can literally happen to anyone, anytime, the source highlights two incredibly fit, active Japanese celebrities: the famous stage director Amon Miyamoto and the marathon runner Kenpei Hazama. Both of these guys were thriving. They felt 100% perfectly fine with zero symptoms, but they both found out they had early-stage prostate cancer, completely by chance. Miyamoto during a televised medical checkup and Hazama during a standard physical before a big race. Because they caught it early through elevated PSA levels, they got treatment and are alive, healthy, and killing it today.
Let's move to and see how this builds, because I know exactly what some of you are thinking right now. If I get a PSA test and it comes back high, they're going to instantly jam me with needles for a painful biopsy. Honestly, that used to be a massive, valid fear. Actually, scratch that. Medicine has completely evolved. Today's diagnostic pipeline is so much smarter. Step 1 is the PSA blood test. If it's high, step 2 is an MRI scan. The MRI acts like a scout. It looks at the prostate to see if it's just benign swelling, inflammation, or if it actually looks like cancer. You only move to step 3, the targeted biopsy, if the MRI finds a truly suspicious shape. So no, a high PSA doesn't automatically mean unnecessary needles anymore.
Now, get ready for literally the most reassuring number you will see in this entire explainer: 100%. If you catch prostate cancer in its early stages, again, before any of those horrible symptoms appear, the 10-year survival rate is virtually 100%. It's an incredibly manageable, totally treatable disease as long as you just don't give it a head start. Plus, getting that early diagnosis doesn't automatically mean you're rushed into aggressive surgery or heavy radiation. For a whole lot of guys, the doctor's actual recommendation is something called active surveillance. Doctors use this thing called a Gleason score to figure out how aggressive the cancer cells are. If the cancer is small, contained, and looks totally docile, they'll often just say, let's do watchful waiting. You don't jump into harsh treatments that mess with your quality of life. Instead, you just regularly check your PSA levels and keep a really close eye on it. There's this huge Japanese study that looked at men who went the active surveillance route, and the results are honestly so empowering. Over a 5-year stretch, exactly 50% of the men safely stayed on surveillance without ever needing a single treatment. Their cancer just stayed completely quiet. The other 50%, they eventually saw some slight changes in their PSA or MRI, and they just smoothly transitioned into treatment right when they needed to. The point is, finding it early gives you the absolute ultimate luxury in medicine. You get options, and you keep control over your own body. So what does this all mean for us? It means we absolutely have to stop waiting for our bodies to sound the alarm when it comes to the prostate. Because by the time it finally speaks up, it's usually shouting. The PSA test is just a simple, everyday key that unlocks total peace of mind and basically secures your future. So I'm going to leave you with this provocative question to chew on. If you're over 50, or if you have that family history, when is your PSA test? Don't sit around waiting for a sign that's never going to come. Take control, get the blood test, and protect your tomorrow. See you next time.